Health monitoring. The benefits: detects disorders early. You may have symptoms but not know what they mean. Monitoring provides an opportunity to detect and diagnose disorders early and initiate treatment. Detects preconditions. Monitoring makes it possible to detect some preconditions, such as pre-malignant stages in the cervix, so that, if necessary, treatment can be started. Early medical treatment. In general, starting treatment early for a condition is likely to be more effective and reduce your long-term risk of developing possible complications. Detects asymptomatic conditions. Monitoring enables some conditions without symptoms, such as high blood pressure, to be detected. Identifies key health risks. Monitoring can help identify factors that could affect your long-term health, such as lifestyle changes, enabling interventions to reduce the risk. Early non-medical interventions. Monitoring provides a chance to see the effects of making healthy changes to your lifestyle, such as improving your diet and being more active. Why monitor your health? Health is a state of physical and mental well-being, not merely the absence of disease. Generally, most people are well most of the time. However, health monitoring is useful because it can detect risk factors or the early signs of a condition that might become a health problem. Advantages and disadvantages of monitoring. Monitoring provides a positive way for you to learn about your own body and is an opportunity for you to engage with and affect your own health. Early detection of conditions by monitoring can even improve your life expectancy. For example, by detecting prediabetes, early medical intervention together with lifestyle changes could delay the onset of the disease itself by several years. However, it is important that monitoring provides accurate results that do not lead to unnecessary further tests because of a wrong positive result or lead to you ignoring symptoms because of a wrong negative result. Although health monitoring tests are not perfect, in general, monitoring is beneficial because of the advantage of early identification of a problem and because identifying risk factors early may help you to take appropriate action. Disadvantages and limitations. Tests not 100% accurate. No medical test gives completely accurate results for everybody every time. A test may give a false negative or false positive results. False negative result. When a test gives a false negative result, it indicates that you do not have a condition. In reality, you do. Stress. Having tests and waiting for the result can cause stress. A positive test result may lead to more stress, even if the result is a false positive. False positive result. When a test gives a false positive result, it indicates that you have a condition when, in fact, you do not. Additional unnecessary tests. A test that gives a false positive result may lead to further tests that are not needed because you do not actually have the disorder. Tests provide only a snapshot. Tests only give information about your health at the time of the test. Even if you test negative, you could still develop a problem in the future. Thank you for your attention. Interviewing joy. A normal state of joy is not in itself a cause of this disease. On the contrary, it is a beneficial mental state that favors a smooth functioning of the internal organs and their mental faculties. The simple questions in chapter 39 says, joy makes the mind peaceful and relaxed. It benefits the nutritive and defensive chi, and it makes chi relax and slow down. On the other hand, in chapter 2, the simple question says, the heart controls the joy. Joy injures the heart. Fear counteracts joy. What is meant by joy as a cause of disease is obviously not a state of healthy contentment, but one of excessive excitement and craving, which can injure the heart. This happens to people who live in a state of continuous mental stimulation, however pleasurable, or excessive excitement. In other words, a life of hard playing. As indicated above, inordinate craving is an aspect of the emotion joy, and it stirs up the minister fire, which overstimulates the mind. Joy, in the broad sense indicated above, makes the heart larger. This leads to excessive stimulation of the heart, which, in time, may lead to heart-related signs. This may deviate somewhat from the classic heart patterns. The main manifestations would be palpitations, overexcitability, insomnia, restlessness, and talking a lot. The tip of the tongue would be red. The pulse typically would be slow, slightly overflowing, but empty on the left front position. Joy also may be marked out as a cause of disease when it is sudden. This happens, for example, on hearing good news unexpectedly. In situation, joy is akin to shock. Fei Bo Shong in Medical Collection from Four Families from Menki says, joy injures the heart. It causes yang qi to float and the blood vessels to become too open and dilated. In these cases of sudden joy and excitement, the heart dilates and slows down, and pulse becomes slow and slightly overflowing but empty. One can understand the effect of sudden joy further if one thinks of situation in which a migraine attack is precipitated by the excitement of suddenly hearing good news. Another example of joy as a cause of disease is that of a sudden laughter triggering a heart attack. This example also confirms the relationship existing between the heart and the laughter. Joy affects the heart. Joy makes chi slow down. Joy is a state of excessive excitement and or craving. Joy makes the heart larger. Thank you for your attention.
Let's discuss Han-Yang-Min, large intestine meridian, LI-19. LI-19 on the face inferior to the lateral margin of nostrils at the same level as the midpoint of the philtrum. LI-19, Hill Liao, brain bone hole, long cheek, long bone hole. This point opens the nasal passages and is used for all sorts of nasal problems, rhinitis, loss of smell, or nasal polyps. It can be used with LI-20 to really activate the nose, which is under the auspices of large intestine's partner, the lung. To inhale deeply allows us to participate fully in life, no holding back. Okay. Loss of sense of smell, even temporarily, can lead to feelings of exclusion from life. Food is not so enticing and are no sudden evocative moments while a smell transports you in memory. Smell is one of the key ways to orientate ourselves in our world. The mental element is very sensitive to atmospheres and environments. People know if they love one smells different. They notice how other people's homes smell differently to their own. Each breath with its smooth rhythmic patterns of inhalation and exhalation is in itself a complete cycle. The sum of our breath is the thread from the beginning to end of our life. So it is fitting that the last 2 points on large intestine return us to the place where independent existence begins and ends with the breath. The Hilyao is also eliminates wind and can be used for facial palsy and lockjaw. Indication used as a local point for dental pain. Located in the gap above the canine tooth, can help with nasal problems, rhinitis, loss of sense of smell, or nasal polyps. Also can be effective for local dental problems or facial palsy. Thank you for your attention. Let's discuss heart patterns, blood stasis obstructing the brain. Blood stasis obstructing the brain, collateral patterns. Concept: this pattern is ascribed to blood stasis affecting the brain and blocking its networks, the collaterals, and manifesting as headache, dizziness, etc. Clinical manifestation: headache, chronic dizziness, stabbing pain fixed in one place, poor memory, insomnia, palpitations, or coma after head trauma, dark and dusky complexion, dark purple tongue with blue and purple spots at ready and chappy pulse. Analysis: the pattern is mainly caused by head trauma or chronic disease, eventually affecting networks, leading to blood stasis, which obstruct brain collaterals. Key symptoms: there is headache, dizziness with symptoms of blood stasis. For the blood stasis obstructing the brain networks, when there is static blood obstructing the brain networks, bringing about pain. So this results headache, stabbing pain, or even coma. When there's failure to move qi and blood freely and unable to nourish the brain, there is chronic dizziness. If there is blood stasis, prevents producing of production of new blood, unable to nourish the heart. This results to poor memory, insomnia, and palpitation. Symptoms of blood stasis: fixed pain, dark, dusky, and lusterless complexion, a dark purple tongue or with cyanotic spots or purple dots at ready and chappy pulse. For the summary: heart blood stasis, etiology, prolonged anxiety, grief, anger, chronic illness, severe blood loss, poor diet. Underlying or accompanying pathology: heart-yang deficiency, heart blood deficiency, phlegm obstructing. Possible presenting conditions: there is angina, pectoris, coronary heart disease, myocardial infarction. Signs and symptoms: there is dull pain and oppression in the chest, anterior to the heart, tiredness and fatigue, palpitations. Attack characterized by gripping, stabbing, or pricking chest pain. May radiate to shoulder or down inner arm. Constriction of chest, green, blue, or purple cyanosis of lips and nails, cold lips. The pulse is knotted, wiry, or choppy. The tongue is purple. For the treatment principle, we have to rectify and quicken the blood and transform stasis. Comshen, warm, and supplement heart-yang. Acupuncture treatment: we use pericardium 6, regulates heart blood, opens chest. Pericardium 4, accumulation point, stops heart pain. Bladder 14 regulates heart blood. Bladder 17, with the use of moxa, gathering point for blood. Bladder 15 clears the heart, supplements heart chi. Heart 7 supplements and pacifies mind. Ren 17 regulates chest chi and blood. Spleen 10 regulates blood. Kidney 25 moves chi and blood in the chest. Ren 14 clears the heart. We have to needle with even method. Heart blood stagnation is characterized by cardiac pain and pain in the chest. Only this pattern and blocked heart vessels manifest with cardiac pain. Heart chi stagnation and phlegm stagnation will manifest with a tight and a heavy oppressed sensation in the chest respectively. Heart blood stagnation can be a purely excess pattern and a combined deficient and excess pattern, depending on the underlying pathology. Thank you for your attention.
Pulse taking, leaky roof pulse, and slow pulse. The rate of the leaky roof pulse is very slow, often in the range of 21 to 40 beats per minute. It resembles water drops dripping from a leaky roof, a drop now and then, and without force. The rhythm may be regular or completely irregular. The leaky roof pulse indicates complete collapse of stomach chi and nutritive chi. It is a sign of imminent death. This pulse can be seen in a variety of rheumatic valvular illnesses of the heart, severe coronary artery illness with advanced hardening, advanced cardiomyopathy, abnormality of the heart muscle, or markedly high blood potassium levels. When stomach chi, nutritive chi, and defensive chi collapse, complete exhaustion of meridian chi is imminent. There is then no motive force for circulation, and the leaky roof pulse is the result. The rate for a slow pulse is in the range of 40 to 59 beats per minute. The rhythm is basically regular. A slow pulse indicates an illness of cold. A slow and forceful pulse indicates a cold strength illness. A slow and weak pulse indicates an illness of deficiency cold, most commonly accumulation of yin cold or deficiency of yang qi. A slow pulse can occur in heat illnesses, principally when heat is barricaded in the stomach and intestines, or heat is in the nutritive and blood levels of the warm diseases. Note that a slow pulse may be seen in normal healthy persons, especially athletes or those who regularly engage in physical labor. The slow pulse occurs in illnesses of cold because cold causes impedance of qi. When yang qi is impeded, blood circulates more slowly, resulting in a slow pulse. In an illness of heat, gelling of heat can also impede qi movement and produce a slow pulse. So to summarize, the leaky roof pulse is the rate is 21 to 40 beats per minute. Rhythm may be regular or absent. And this indicates exhaustion of stomach chi, nutritive chi, seen usually in serious arrhythmia and other illnesses. So this is deficient stomach chi, nutritive chi, and defensive chi, imminent collapse of meridian chi, no motive force for blood circulation. Slow pulse rate is 40 to 60 beats per minute with regular rhythm. Cold impeding flow of yang qi and blood. Jailed heat can also impede qi circulation. Clinical significance is cold, strong yin cold in interior, or deficiency of yang qi, heat in nutritive and blood levels of the warm illnesses. Thank you for your attention. Diagnosis according to Zhangfo organ patterns. Damp heat in the liver. When there is damp heat in the liver, there are signs and symptoms of a generalized damp heat condition, as well as specific liver symptoms and signs. It is important to note that damp heat in the liver can be a relatively serious condition. It is often seen when the liver in Western medicine physiology is not able to break down and excrete bilirubin as it should. Symptoms of damp heat in the liver can indicate that there has been a significant reduction in the liver function due to some form of liver failure. Excessive consumption of food and medicine that are hot in their energy or produce dampness is the etiology of damp heat in the liver. Emotional imbalances that weaken the spleen or stagnate liver qi and thereby generate heat in the liver. This could be worries and speculation that bind and thereby weaken spleen qi or unresolved emotions, frustration, repressed anger, irritation, and so on that stagnate liver qi. Exogenous dampness can invade the liver channel in the legs and be transmitted via the channel to the liver organ. There can also be direct invasions of exogenous damp heat, especially in tropical climates. The condition can also arise when there is latent heat from an unresolved pathogen in the liver. This can lead to chronic conditions such as hepatitis in Western medicine. Symptoms and signs: fever or aversion to heat, chest oppression, costal tension or pain, hypochondriac tension, sense of heaviness and fatigue in the body, yellow skin color and yellowish sclera, red and suppurating skin diseases, rashes and sores, itching, burning, or stinging skin, sores or rashes, genital sores or sores around the mouth, copious, odorous, yellow, sticky vaginal discharge, swollen or red and painful genitals, irregular menstrual bleeding, spotting, yellow, sticky sweat, bitter taste or sticky sensation in the mouth, dark and scanty urine. The urine may be odorous, burning urination, poor appetite, nausea, thirst with no desire to drink, red tongue with even redder sides, greasy yellow tongue coating, rapid, slippery, and or wiry pulse in the left quant position. These symptoms, feelings of heaviness and fatigue, bitter or sticky taste, nausea, yellow skin and sclera, dark urine, and yellow greasy tongue coating. Treatment principle, drain damp heat from the liver. Acupuncture points, we choose from liver 2, 5, 8, 14, bladder 18, 22, GB 34, 41, SJ5, spleen 6, and 2, 9. Needle technique is draining. Liver 2, 14, GB 34, and bladder 18 drain damp heat from the liver. Liver 5 and 8 drain damp heat from the lower jaw, especially the genitals. GB 41 and Sanjiao 5 open thigh and drain damp heat. Bladder 22, spleen 6, and 29 drain damp heat. When there is damp heat in the liver, the person should avoid consuming substances that create heat or dampness, especially if these substances have an affinity with the liver. Alcohol, hot spices, fried food, and too much red meat should be avoided. Foods such as dairy products, sugar, sweets, nuts, bananas, and other damp producing foods should be also avoided. A liver that is burdened by medication, alcohol poisoning, and so on will have difficulty metabolizing chemicals. Therefore, caution should be exercised in the consumption of all kinds of medicine, including dietary supplements and herbal remedies. Stress and pent up emotions, especially anger and frustration, create heat in the liver. It is therefore important to address these emotions when possible. Physical activities such as sport and fitness, Tai Chi, Yoga, or Qigong will be beneficial because it will help to disperse stagnant liver qi, which is often involved in the creation of damp heat in the liver. Damp heat in the liver can be caused by spleen qi deficiency, damp heat, liver qi stagnation, heat, invasions of pathogenic qi, and can result in liver fire, phlegm, liver blood stagnation. To summarize, etiology of damp heat in the liver includes irregular diet and lifestyle, excessive consumption of greasy foods, excessive anger, climatic damp heat. Underlying accompanying pathology, spleen qi deficiency with dampness, stagnation of liver qi. Signs and symptoms, fullness in the hypochondrium, bitter taste, nausea, poor appetite, heaviness of the body, yellow vaginal discharge, vaginal itching, genital rashes, mid-cycle bleeding or pain, redness and swelling of the scrotum, difficult burning and painful urination, pulse, slippery, wiry, rapid, tongue red with redder sides, sticky yellow coating. Treatment principle, coarse liver and clear damp heat, transform damp in the middle burner. Acupuncture treatment. Bladder 18 dispels hepatocystic damp heat. Liver 14 calms the liver and disinhibits qi. GB 24 courses the gallbladder, transforms damp heat. Sanjiao 6 with GB 34 relieves pain in the lower ribs. Spleen 9 moves central burner and transforms damp heat. Liver 3 courses liver qi, needle with drainage. Thank you for your attention. Skin inspection, macular rash. The skin is the barrier of defense against external pathogens. All illnesses, whether due to exogenous pathogenic evils or endogenous pathogenic factors, have the potential to cause abnormalities in the skin. When inspecting the skin, pay close attention to the changes in its color, moisture content, appearance, and texture. The clinical significance of skin color is similar to that of the facial complexion. Here, the emphasis is on the following. A macule is typically red in color. It is flat and cannot be distinguished by feel from the surrounding skin. It may be a dot or a patch and is of variable size. It does not lose its color when pressed. Clinically, there are two varieties, yang macules and yin macules. A young macular rash is mostly seen in illnesses due to exogenous heat, and its presence indicates that the heat, that is, the pathogenic evil, has entered the nutritive and blood levels. Usually, there are the additional symptoms of fever, thirst, a red or crimson tongue, and a rapid pulse. If the macules are sparse, bright red in color, appearing first on the trunk, then extending to the limbs, and at the same time the fever subsides and the mind clears, it is an indication that the evil chi is dissipating through the skin and the illness is improving. Conversely, if the macules are numerous, red or dark purple in color, appearing first on the limbs and extending to the trunk, but the fever persists and the mind remains clouded, it is an indication that genuine chi is unable to defeat evil chi. A yin macular rash is due to deficiency of both chi and blood and inability of the spleen to control blood. It is characteristically light red or dark purple in color, sparse without specific locations, and irregular. They also appear and disappear unpredictably and are often accompanied by pale lips, pale tongue, cold limbs, and a depletive pulse. In general, a young macular rash indicates an illness of exogenous heat, whereas a yin macular rash indicates an illness of deficiency cold. Thank you for your attention. Western differential diagnosis for epigastric pain. From the perspective of Western medical diagnosis, the most important task is to differentiate between the organs from which the epigastric pain may stem. These can be esophagus, we have esophagitis, carcinoma of esophagus, stomach, gastritis, gastric ulcer, perforated ulcer, carcinoma of the stomach, duodenum, duodenal ulcer, pancreas, pancreatitis, carcinoma of pancreas, large intestine, appendicitis, irritable bowel, gallbladder, gallstones, acute coronary syndrome or ACS, inferior wall myocardial infarction. Esophagitis is an acute or chronic inflammation of the lining of the esophagus. The most common cause is a condition known as gastroesophageal reflux disease, and a hiatal hernia can worsen GERD symptoms. Common signs of esophagitis include pyrosis or heartburn, acid regurgitation, dysphagia, difficult swallowing, odynophagia, painful swallowing, chest pain, particularly behind the breastbone, epigastric pain, and food impaction, swallowed food becoming stuck in the esophagus. Carcinoma of the esophagus. In most cases, this manifests with dysphagia, difficulty in swallowing, and it may be rarely associated with thoracic or epigastric pain. Gastritis is a general term for a group of conditions with one thing in common, inflammation of the inner lining of the stomach, known as the gastric mucosa. It may occur suddenly, acute gastritis, or develop slowly and last for a long period of time, chronic gastritis. A number of conditions, such as Crohn's disease, can increase the risk of gastritis. Risk factors include older age, regular use of pain relievers, abuse of anti-inflammatory drugs, excessive alcohol use, stress, autoimmune disorders, and bile reflux. In addition, gastritis can be associated with bacterial infections, particularly Helicobacter pylori and pernicious anemia. Main symptoms of gastritis include pain and burning ache in the upper abdomen, stomach cramps, nausea, vomiting, and a feeling of fullness after eating. Gastritis does not always cause signs and symptoms. Gastric ulcer is characterized by ulceration of the stomach's mucous membrane. The most common causes of gastric ulcers are infection with the bacterium H. pylori and long-term use of nonsteroidal anti-inflammatory drugs. Irrespective of its cause, the mechanism underlying ulcer formation is always an imbalance between factors promoting mucosal damage and factors promoting gastroduodenal defense. Gastric ulcer causes epigastric pain, which comes in bouts lasting for a few weeks or at intervals of months. The pain occurs approximately 30 minutes after eating and it is not relieved by eating. There may also be nausea, regurgitation, and distension. If the ulcer perforates, this is a serious emergency and the patient should be hospitalized as soon as possible. It is characterized by a severe epigastric pain, which soon spreads to the whole abdomen and is aggravated on coughing and deep breathing. The patient looks very distressed and the abdomen is rigid and hard and characterized by board-like rigidity. Perforation may cause severe signs and symptoms such as nausea, vomiting, sweating, tachycardia, and weak pulse, and the patient assumes a fetal position. This is followed by an increase in the pulse rate, and the patient's condition becomes more and more grave. The symptoms of stomach cancer can include dyspepsia, heartburn, or stomach pain, digestive problems, a sense of fullness after eating a small meal, feeling bloated after eating, nausea or vomiting with or without blood, blood in stool, difficulty swallowing, fatigue, poor appetite, vague discomfort in the abdomen, usually above the navel, and unintentional weight loss. Thank you for your attention.